Hi, I'm Dr. Jack West, medical oncologist in Seattle, Washington. Up to about a third of our patients with advanced non-small cell lung cancer have a performance status in the marginal range of 2 or sometimes worse, and yet we have very little information about how to treat these patients, particularly with regard to immunotherapies that have really transformed our management of the broader lung cancer population. Coming out of ESMO 2018, we have a little more information to help guide us, and it is encouraging. Dr. Gary Middleton from the UK presented results of what's called the PEPS trial, or Pembrolizumab in PS2 trial. This was for patients with advanced non-small cell lung cancer and a marginal performance status of 2 without regard for PD-L1 expression, though tissue collection for PD-L1 assessment was mandated. This was a UK-based trial, as I mentioned, 60 patients enrolled, and the vast majority, 85%, had received prior therapy for their cancer. They received pembrolizumab at a fixed dose of 200 milligrams IV every 21 days, and then underwent repeat CT scans to assess objective response rate every 9 weeks. The study focused on co-primary endpoints of durable clinical benefit, which was defined as complete and partial responses as well as stable disease after an interval of 18 weeks, and also toxicities, dose delays, or treatment discontinuation due to adverse events in this marginal PS population. So the overall findings showed a durable clinical benefit of 33% in the broader unselected population, though the results were notably more favorable in the 15 patients, or 25%, who had tumor PD-L1 expression of 50% or greater. And in that group, the response rate was 58.3%. Now, the progression-free survival in the full trial population was 5.4 months, but in the high PD-L1 group it was 8.5 months. Median overall survival was 11.7 months in the broader population, 16.6 months in the patients with high PD-L1. And these results really are very encouraging, even broadly, but especially in the patients with high PD-L1, and especially considering that the majority of these patients had already received prior therapies. On the other side of the issue is toxicity, and this was not greater than had been seen in prior experience. There were no grade 5 adverse events, there were no cases of hyperprogression observed, and so I would say that this is really an important result, even though it's not a large study. It's enough to demonstrate at least a proof of principle, if not a critical mass of data, to suggest that patients with a performance status of 2 can benefit meaningfully from immunotherapy in general, pembrolizumab in specific, without prohibitive toxicity issues, and that the patients with PD-L1 and especially high PD-L1 may do extremely well with it. So it is something that we should hope to study further, get more information, but in the meantime, I feel very inclined to offer this to a broader range of patients than only the most fit patients who have been the subject of the bigger studies up to now. I welcome your thoughts and comments. I hope you'll like, comment, and subscribe. Take care.